Hey, well, welcome everybody to our Prepared for Environmental Change webinar. Today's topic is ticks, asthma, and allergies. How can the changing climate affect our health? So my name is Andrea Webster. I'm the implementation manager here at the Environmental Resilience Institute. I am going to get you started with just a few webinar logistics, and then I'll pass it over to Janet McCabe, our webinar moderator. So I want to let you know that everybody on the call is muted. We ask that you save your questions until the end, but if you have an urgent or clarifying question during the presentation, you may send a question through the chat function, which you can access by hovering your mouse over the video screen over the Zoom window. Then you should see a chat option appear. So if you have any questions, please enter them through the chat, and we will moderate them and save them for the end. So for now, I'm very pleased to introduce ERI's new director, and Janet McCabe. So from here, I'll hand it over to Janet to moderate today's webinar.
Great. Thank you, Andrea. And thanks to everybody for joining us. I'm particularly excited about this webinar. I get very excited about all our webinars, but I'm particularly excited about this one because for me, climate change and environmental changes are all about public health. And that should be top of our list in terms of making sure that people understand what the public health implications of these changes that are happening are. And so I'm very, very pleased with the speakers that we have today, who I'll introduce in a minute. And I want to thank you all for joining us. Every time I get on one of these webinars, I wish there were twice as many people dialed in. Please spread the word if you think that this is useful. Just quickly, for those of you that may not be familiar with the Institute, the Environmental Resilience Institute, which is a product of IU's Grand Challenge Prepared for Environmental Change. Oh, thank you, Andrea, is focused on producing useful research and programs for Hoosiers, for communities, for businesses, for people across the state, related to environmental change and climate change. In particular, the programs that Andrea and I work on are focused towards local governments. And local governments to me means also the businesses and people and organizations that, that exist within those local governments. And this webinar series is one resource that we've provided, but there are others as well that I won't go into on detail because we don't want to take the time for that. But you can feel free to ask us about any of those. We have some upcoming webinars. The next one also is about public health, focused more on solutions, although you'll be hearing something about solutions today. Andrea, I don't know if we have a slide that shows the next webinars. There we go. In November, our webinar is going to be about the Hoosier Resilience Index, which is a project that we are working on and will be launching on November 2nd. This is an interesting tool that we're developing to help communities understand their particular vulnerabilities with respect to climate change, and that will be based on information that's been developed through the Indiana Climate Change Impacts Assessment and other public databases. We will provide that kind of information for every city, town, and county in the state. And the second part of the index will be sort of a worksheet-based, do-it-yourself assessment for a community on how ready they are for the particular vulnerabilities that they have. We've been testing it with 4 different local governments this summer, and we think it's going to be super useful for people. So we will have a webinar completely devoted to that in November. And then another topic near and dear to my heart in December is going to be on zoning and comprehensive plan strategies and how to build climate sensitive program policies into the way local governments make decisions. So super important. So let's go to the next slide. I want to thank our longtime supporters of this webinar series, Accelerate Indiana Municipalities and the Association of Indiana Counties. I think you all know what they do, the important work that they do. This time, I also want to thank new sponsors. Health by Design and the Indiana Public Health Association, who you won't be surprised to hear was particularly interested in the topics today. So, so thanks to them. And that will lead me to thank Kim Irwin, who is the Executive Director of Health by Design and also the Director of the Public Health Association. Health by Design is an organization that I've worked with for many years. It works at the intersection of the built environment and public health, helping to educate people on how to build our communities so that we will be healthier. And she administers the Indiana Public Health Association, in which role she guides the strategic direction, partnership development, and programmatic, operational, and financial management of both organizations. She has a Master's of Public Health from the Indiana University School of Medicine Department of Public Health, yay, and an undergraduate degree from Northwestern. So I'm going to turn it over to Kim for a few moments, and then she'll turn it back to me to introduce our speakers.
Hi, everyone. This is Kim Irwin speaking. It's great to be with you today. Thank you for participating. Yes, just a chance to say hello and reinforce how important this connection is between climate change and public health, and that we as public health professionals, we as public health organizations want to be doing everything we can, one, to ensure that people are aware of that connection, to understand the long-term impacts of that, and to understand how public health professionals, but our partners beyond that, can be involved in mitigating risk and preparing for resiliency. As Janet mentioned, Health by Design works at the intersection of the built environment and public health. So our work is all about transportation systems, land uses, planning and zoning. So I love the comprehensive planning topic coming up in December, our parks and rec and green space, and how all of those things or all of those things in our environment either support healthy, active living or detract from it. And so many of you have been involved in that work, always more to do. In January of this year, we began managing the Indiana Public Health Association, and that has offered an opportunity to even further expand our interest within public health, to get more involved with work happening across the state, particularly with local health departments and others. And so we're glad to be in that role and looking forward to continuing to work with the Environmental Resilience Institute, but all of you as well. Thanks, Janet.
Great. Thanks, Kim. We're just delighted to have your partnership on this, and you have access to a whole world of public health folks and organizations that I hope we can get engaged here. So somehow I'm not seeing slides, so I need to, I'm going to count on the fact, Andrea, that there we go, that the slides are up there. We have over 35 people and organizations registered for today's webinar. That's fantastic, but not nearly enough, so please spread the word. And after you hear the presentations today, I know you will be inspired to do so. So I'm going to introduce both of our speakers now so that we can just move from one to the other seamlessly and save time. First, we will hear from Melissa Widhalm. Melissa has actually been a presenter on our webinar series before. She is operations manager with the Purdue Climate Change Research Center, which is located in West Lafayette. She's the program coordinator for the Indiana Climate Change Impacts Assessment, which is just an amazing resource that we have here in Indiana. It's a statewide collaborative effort to develop a series of reports designed to help Hoosiers better understand climate change related risks so that they can better prepare for the future. And I can assure you from my personal experience that not all states have this kind of resource available to them. Melissa is responsible for overseeing report development and dissemination. And I know, I've seen her travel schedule. She is all over the state talking about these reports and climate change throughout Indiana. She has a Bachelor of Science degree in meteorology from Northern Illinois University and a Master of Science degree in natural resource science from the University of Nebraska-Lincoln. And she will be talking about the chapter produced under this effort that focuses on public health impacts of climate change in Indiana. She will be followed by Dr. Dana Habib, who we're thrilled to welcome to the webinar series. Dana is an assistant professor in the Department of Informatics at IU. She's trained as an architect and urban designer and brings a design perspective to her research in environmental planning and health. She has a focus on designing local interventions and investigates ways to engage and empower individuals to respond to current and future environmental problems by synthesizing research in climate change, public health, and environmental sensing. Her research explores how climate responsive design can help mitigate climate change and address environmental challenges to improve the health of individuals and communities. And she will be speaking a lot today about heat and the risks of increasing heat in our communities. I am going to turn it over to Melissa, and I'll just remind people that if you have questions along the way, please feel free to put them into the chat box. And if they are burning questions that should be asked right away, Andrea or I will be rude and interrupt, and otherwise we'll save them to the end. So Melissa, I'll hand it over to you.
All right, thank you. Can you hear me?
Yes, we can.
All right, I'm going to go ahead and share my PowerPoint here. All right, are you seeing my title slide? I think we're good. Yes? All right, I'm going to take that as a yes.
You got it.
All right. Thank you so much. So again, my name is Melissa Widhalm. I'm going to just do a quick review of the Hoosier Health in a Changing Climate, which is the chapter from the Indiana Climate Change Impacts Assessment. I won't be able to go too much in depth. I usually will go through a lot of the climate changes and all of that first, but in the interest of time today, we're going to just jump right into the health report. I'm going to hit on some of those key messages, and I really, this is meant to be an overview. We want to save time for our second speaker as well, so I'll move quickly. Go to the website. Check out the report. We have a ton more information there than I'm able to share with you here today. And I hope this really helps you get that overview to set the stage for what kind of risks we're talking about here in Indiana related to our health. So all of this, again, it comes from the Indiana Climate Change Impacts Assessment. While it's led at Purdue University, it really couldn't have happened without the dozens of universities, private groups, nonprofits, state agencies, and other experts in our state that have contributed in a variety of ways to the overall assessment. We have something like 100 content experts working on a series of different reports. I've put the topics here up on the screen, and that is no small effort, as you can imagine. So we have reports right now available on climate, health, ecosystems, a whole bunch of them. Today we're focusing on health. The two that I have up on the screen that you're not going to find at our website yet are water resources and infrastructure. Those reports are in progress. We're hoping to have one of them out later this year and the other one out early next year. So, and we're constantly putting up new resources to help people interpret, understand, and share all of the great information we've been able to compile from our experts right here in our state. So even if you've already read the reports, keep coming back to the website, find our newsletters, find our other resources, get in touch with us so we can continue this great work. And again, while I showed you earlier some of the groups that are working on the impacts assessment more broadly, what I have shown here is really that health working group. These are all the folks that really contributed to the work here on this chapter. It was led by Gabe Filippelli at IUPUI with contributions from a whole number of folks there on the screen. So when we're talking about climate change and human health, it's really all about the pathways. It's really all about these rippling effects, okay? So we get these changes in temperature, we get changes in rainfall. They interact in a variety of ways to affect the length of our growing season, the intensity of our rainfall, how hot or how cold we get, and from there we see these rippling effects. So we can think about when we have a heat event, we're going to see things like heat stress, cardiovascular failure. When you have changes in heat, you're going to have changes in air pollution. That's going to trigger some problems for asthma. You can see how we get these rippling effects. And so what I'm showing here is just kind of that summary of how these different health outcomes tie back to changes in factors that are directly and indirectly affected by climate. All right, and so when we have a changing climate, these are all parts of a wheel that are changing. Okay, so it can become pretty complex. But I think what's really important to also remember from this is while we have direct and indirect effects that affect our health outcomes, what we're not seeing in this slide is that management component. And that's something our second speaker is going to talk about, is that a lot of these things can be helped or further exacerbated depending on how we prepare or don't prepare for the impacts that are coming. And so really just having this baseline awareness here in our state of how these pathways are going to manifest into impacts that we see in our real communities is really important. So one of the primary findings from our impacts assessment is that when we start having these increasing temperatures, okay, we're expecting to see about 5 to 6 degrees of warming in our average temperature by mid-century, and that's warming across all seasons. When we start having that, that's going to change our extremes. So we're talking about more extreme heat, less extreme cold. Well, when we're talking about that, that has an impact on heat-related illnesses and deaths. And there's a seasonal component to it. So overall, if we look at it over the course of a year, and I've highlighted it here in blue, we're going to expect to see about a doubling of temperature-related deaths here in our state by mid-century. But that's going to come from a mixture of fewer deaths in the winter and more deaths in the summer. So many more that it then outweighs that benefit that we're seeing in the winter. Okay, and I have another slide on this that I'll show you in just a moment. So that's really the takeaway when we're talking about heat-related illnesses and impacts. We are going to see quite a few more of them as temperatures continue to change. And it's not going to affect everybody the same. Children, the elderly, low-income households, folks that have pre-existing health conditions, they're going to be at the greatest risk and the greatest susceptibility of feeling that heat stress. So if we look at this graphically, let me just take a moment to show you what we're looking at here. We have a few different cities that we've pulled out. And when we're looking at this graphic, we're looking at the change in the premature deaths per year for a few different time periods, okay? So early century would be 2030s, mid-century, late century. If you're above that zero, that means you're adding deaths. If you're below that zero, that means you're having fewer deaths, okay? You're saving lives. And so the blue arrow, that's representing our cold season. The red arrow, that's representing our warm season. And so you can see over time, we are having fewer and fewer cold season deaths as temperatures warm, more and more warm season deaths as temperature rise, and the net effect of that overall is an increase in heat-related deaths and injuries. If we look at how this plays out with extreme heat, I don't have showing the cold winter temperatures just for the sake of time, but what we're looking at here is, again, if we can look at different parts of the state, this black bar is showing historically how many extreme heat days do we have in a given year. This is looking at 95 degrees. Well, in the past, we would have about 4 of those days in Marion County. This is an average. Some years you're going to have a lot more. Some years you're going to have a lot less. When we average it out, that baseline that we're looking at is about 4 days with that extreme heat. So when we look at our baseline and how that's changing, if we go out here to middle of the century, in the central part of our state, we're looking at 27 to 39 days each year with temperatures above 95. That is a significant change, and you can see how that would cause a pretty large increase in heat stress, heat-related injuries. But again, it's something that can be managed for. This number can be a lot lower when we start talking about how it impacts health if there are interventions in place to help our communities cope with that change. So heat's only one of the ways that we're talking about impacts of climate change on human health. Air quality is also a big one. Okay, so I'm going to show you two slides here. One air quality related to ozone and one air quality related to allergens and pollen. And so here, the key finding related to the report is that when we have higher temperatures and stagnant air, we're going to see an increase in that ground level ozone production and a worsening of air quality. Okay, so what happens is as temperatures rise, ground level ozone increases. Okay, so it's a lung irritant. It's caused, that ozone is caused by fossil fuel emissions. And so when you're in a city and you're standing there at the bus stop and you have all of those cars blazing by you and a lot of that ozone is being produced when those temperatures are above a certain threshold, right? The higher that temperature, the more of that ozone is being triggered, okay, from those emissions coming out of the tailpipes. Why does this matter? If we have this kind of reduced air quality, it can trigger asthma attacks, heart attacks. It can worsen respiratory and cardiovascular diseases. If you're somebody who has high blood pressure, diabetes, heart failure, COPD, these can be deadly. Okay, these air quality days can be deadly. So air quality and temperature go hand in hand, and that's something we really need to be paying attention to and preparing for right now and into the future. If we're thinking about air quality as allergens, remember I said ozone was one, allergens were another. Indiana's allergy season is projected to lengthen by about a month over this next half century. Okay, and so that's because we're having a longer growing season. When we have warmer temperatures, when we have these seasonal shifts, we're going to see that frost-free period, when really follows that allergy season, lengthen. All right, a few more weeks early in the spring, a few weeks later in the fall. That's just more time when we are exposed to those allergens. But also, it's not that we'll have a longer period, it's that it's expected to be more intense. Okay, so ragweed, other plants, they produce more pollen when they're grown in warmer, carbon dioxide-rich environments like we're expecting in the future. Okay, so insects are another pathway that we need to be thinking about, both with things like ticks and mosquitoes. So in the past, we've already seen that ticks have expanded their range and increased their reproduction rates across Indiana as our temperatures have warmed. And we expect that trend to continue and intensify as that warming continues. Similar story with mosquitoes. Okay, we've already been seeing observations that mosquitoes, the population of those mosquito numbers are going up, up, and up. We have greater spring rainfall. We have warmer temperatures. That creates conditions where mosquitoes and ticks thrive. Okay, and as you start changing things like the lowest temperature of the year, for example, you're not going to be killing off as many of those insects. You're going to be creating conditions that make it more favorable for those pests to overwinter. Right now, it's those lowest temperatures of the year that are really effective at keeping those population numbers down or keeping certain species out of our area entirely. Okay, so as we start to see warmer winters, not just in the average, but in the extremes, now we're talking about the potential for more types of species that we don't want here, that typically aren't found here, to then become residents here in our state. Okay, so what we're showing here on the screen, I'm looking at the lowest temperature of the year. Again, this is an average of the past on the left. Some years are going to be much colder, other years not as much. And then on the right, that's that projection for the middle of the century. So you can see that baseline that we're talking about being warmer by about 6 degrees. That has real impacts on pest life cycles. All right, one more that we'll run through here, and that has to do with water-based problems. So it doesn't take a real stretch of the imagination to see how water can then translate into impacts on our health. Okay, so we've been seeing an increase in precipitation over time. I'll show you a slide here in just a moment that demonstrates that. And with increased precipitation comes heightened risk of flooding. These trends, again, are expected to continue and intensify. As you can see here, floods directly impact human health through physical injury, displacement, property loss, post-flood mold and fungus. What's not shown here, things like the mental health and stress impacts, those are very, very real. People have to deal with those, and we're expecting them to have to deal with them more often. Okay, so I've said we've already been seeing an increase in our rainfall. On average, our state has about 5.5 more inches of rainfall now in a given year than we did a century ago. Okay, and more of that rain is coming in heavy events. That has implications for flash flooding, for river flooding, urban flooding, you name it. That's shown there on the left, that increase in average rainfall. It's not exactly the same throughout the whole state. Southern parts of the state seeing a higher rate of change, northeastern part of the state seeing a lower rate of the change, but across the board, we are getting more water. And it translates into our streams, okay? So we have observed over the last few decades higher stream flows, higher number of days sitting above a flood stage, more of those extreme rainfall events translating into those severe flooding events, that 1 in 500, 1 in 1,000-year flood, that strains our stormwater systems, that gets into our basements, that creates some pretty serious rippling effects on our health. And as we go into the future, again, looking at the past compared to the future, we're talking about, again, more annual rainfall with a strong seasonal component. So flooding at a time of the year when we're already pretty prone to it. And we're talking about maybe reductions in rainfall and water at a time when we actually need it. That has some pretty serious implications for water quality, for algal blooms. Okay, when we start getting lower runoff in the summertime but higher temperatures, that means something to our water quality. All right, so just to wrap it up, here's our summary of what we're talking about from that chapter. What does climate change mean to Indiana health? Well, it means more heat-related injuries and deaths, reduced air quality, a longer, more intense growing season. We're going to be at greater risk for vector-borne diseases from ticks and mosquitoes and such. And when we talk about having more water and changes in the timing of our water, that's going to affect our water quality, flood-related injuries and deaths, mental health, and really for all of these, it's the most vulnerable among us that are unfortunately going to bear the brunt of these impacts. All right, I really do appreciate your time. I apologize for having to move so quickly. I'll be on for the rest of the webinar if there's questions, and my contact information is here so you know how to reach me further. Thank you so much.
Thanks so much, Melissa. This is an overview, but I think it's a great one, and there's so much more information below that. I want to just quickly mention that on some of these issues, there are people at IU who are doing further research on them. For example, ticks. We have researchers who are studying the movement of ticks around the state, whether they are disease-bearing, and there will be more results coming from that research in the future. So I will turn it over to Dana now to do a little bit of a deeper dive into what you've just been hearing about how much hot weather we're going to be having.
Great. Can everyone see my screen?
I can see your screen.
Hi, everyone. I'm Dana Habib. I am an environmental urban planner, and I'm an assistant professor here at IU in the Department of Informatics. So this talk, I will talk about three main topics. I'll first really talk about extreme heat events and the importance role that it plays for public health, and then have a discussion about vulnerable populations, and the role that environmental sensing can play in making our cities smarter and more resilient to our changing climate. So with extreme heat and public health, we see that more people die in the United States to extreme heat than any other natural disaster. We can see this with historical heat waves, like the heat waves in Chicago in the 1990s, where over 700 people died in these events, or the more recent and more intense heat waves, such as the European heat wave in 2003 and the Russian heat wave 2010, where tens of thousands of individuals died during these events. These two heat waves are ranked among two of the deadliest natural disasters for the last century, and really illustrates the important role that extreme heat plays for public health and the importance for us to be planning for extreme heat. We see that cities are more vulnerable to heat waves because of what is known as the urban heat-on effect. The urban heat-on effect occurs when we see temperatures in cities that are higher than their surrounding rural areas. And this temperature increase is due to the way that we are designing and building our cities. We're displacing natural vegetation with impervious surfaces such as buildings, roads, and parking lots, and all that goes to elevate our temperatures in our cities. Not only do we see that temperature is different between our urban and rural, but we actually see a big range of temperature within our cities. And that's a huge aspect of our urban form and how we design our cities really impacts these microclimates, or what we call local climate zones, that we can see temperature change dramatically within an actual city. And so, for example, yesterday here in Bloomington, we actually had a pretty hot day for Bloomington. And when walking through Indiana University's campus, if you're walking through a parking lot versus walking through our Dunn Woods, you were exposed to a higher temperature of over 8 degrees Fahrenheit just in this very small local area. And so how we design and build our cities really impacts the exposures that we have, and where we decide to live and work impacts those exposure levels as well. Research that we have shown is that not only do we see that cities are constantly have higher temperatures in the rural areas, but we see that they're increasing at a faster rate too. And that this faster rate can be attributed to how we're developing our cities, how our cities are sprawling, our development patterns. And so it really goes into how cities are planning for their future and development patterns that can have an impact onto our future local climate. Research I've done, and I've looked at heat wave trends across cities across the United States. And I've looked at heat waves and how heat waves are changing with regard to their frequency, their duration, their season, and their intensity. And we see that across the United States, we see that heat waves are increasing across all of these characteristics. And from a public health point of view, it's important for us to understand heat waves with regard to these characteristics, because we see that these different characteristics will impact our vulnerability to extreme heat and cause higher rates of heat-related mortalities. So we see that heat waves that are longer in durations will have higher rates of heat-related mortalities because they don't allow for adequate recovery periods for people. We also see that heat waves that are occurring earlier in the year will have higher rates for heat-related mortality because it doesn't give people and individuals the ability to acclimatize to these higher temperatures and transition from the cooler temperatures in the springtime. We also are seeing that minimum temperatures, which are considered these high nighttime temperatures, can be a better association with health effects. And this again is important because it's not just the high daytime temperatures, which also impacts our health, but the high nighttime temperatures as well, because they don't give individuals time to recover throughout the day and overnight. And we see that these high nighttime temperatures are amplified in cities because of the urban heat-on effect. In this research specifically, we identified vulnerable cities in the United States, and we identified them by cities that had change of heat wave characteristic trends above the national average, and at least 2 heat wave characteristics. And so we can see that what we are calling vulnerable cities are distributed across the United States. They're not just located in certain areas, and cities that you might not consider hot, like Milwaukee or Louisville or Portland or San Francisco, are showing up as vulnerable cities to extreme heat. San Francisco, for example, has one of the fastest growing heat wave seasons. And for example, in the year 1960s, heat waves were starting in the middle of July. And by the end of the study period, heat waves were starting by the beginning of June, the end of May. So increasing by a month and a half. And this shift in season, we're seeing across the board, and that really has an impact on people's health. It's important for cities to be able to understand how their climate is changing. And so the research that Melissa is doing and presented on with regard to understanding how our climate is changing in Indiana is hugely important. And it's also important for cities to understand how their climate is changing. And so as such, the U.S. Global Change Research Program has taken my methodology and made that publicly available so that cities can learn and learn how they can track temperatures themselves within publicly available data and to see how heat waves are changing within their individual cities. We see that climate change is making us more vulnerable to extreme heat. We're seeing that with climate simulations that places that are having heat waves can expect more heat waves, and that modeling climate change with business as usual scenarios have shown that we can expect a doubling of heat-related mortality by the end of the century, really illustrating that it's important for us to plan for this extreme heat issue. And we see that 2016 was the hottest year start to finish, and the last 5 years were the hottest years on record. So what can cities do to plan for extreme heat to heat waves? They can prepare emergency response plans. Better planning can actually save a lot of lives. Increasing things that they can do is they can make sure to have adequate staffing, and specifically increasing staffing earlier in the heat wave season. They can look at their infrastructure and make sure that they have infrastructure resiliency so that their infrastructure can actually handle some extreme heat conditions. Look at public education. Public education awareness is really important to be able to communicate to the public of their vulnerability of extreme heat. And oftentimes people just don't realize that they are vulnerable to heat and the dangers that they are in. And then also it's important for cities to think about where people have access for cooling. Low-income individuals might not have AC in their homes or can afford to run AC, or we might have power outages in certain areas. So having cooling centers is really important for areas when preparing for emergency response to heat. But cities can also manage their ambient heat. Research that we did, we looked at climate action plans for cities across the United States. And we found that 9 in 10 US cities were pursuing policies to reduce greenhouse gases. We found only 1 in 8 were pursuing policies designed to manage ambient heat. And managing the ambient heat is really looking at how we can mitigate the urban heat-on effect. And so these strategies are strategies such as albedo strategies. And that really looks at how we can change the reflectivity of surfaces in our built environment. So instead of absorbing all that heat, to reflect it. And so Austin has examples of looking at cool roofs throughout their cities, or Los Angeles is doing a lot of movement and investigating ways to do cool streets in their cities. We can, cities can also look at waste heat strategies and look at energy efficiency or ways to reduce the waste heat that's being emitted into their urban environments. And then cities can also look at vegetative strategies. Vegetative strategies in areas with sufficient rainfall have been shown to be one of the most effective ways to reduce the urban heat-on effect. And that we can see that with vegetative strategies, we can reduce it by as much as 50% in some research. And so different types of vegetative strategies could be green roofs, such as we could think of Chicago's green roofs. And we're seeing cities that are using policies to really encourage green roofs by maybe allowing for higher densities and higher floor area ratios in certain areas if people are putting green roofs on. Looking at urban forestation, certain cities are really pushing having a move of planting large amounts of trees in their cities. There's couple cities in the U.S. who have a 1 million tree campaign to plant millions of trees in their city in a certain time frame. But it's important for cities to monitor their tree canopy, to look at how much is changing due to development, and how else is holding up as well to climate changes of plant hardiness zones. And policies such as tree ordinances can go a long way in protecting tree canopy in cities. And then something that's really dear to my heart is really thinking about agriculture and urban agriculture as ways of bringing vegetation to cities as a way to mitigate temperatures in cities. And so with that, and some of the research that I have done is looking at different policies that we can do to try to allow and promote agriculture in cities. And some of my findings is to show that we really, when we're thinking about agriculture as well as other green infrastructure strategies, that during times of extreme heat waves that green infrastructure needs to be managed appropriately so that they actually are providing the cooling benefit that we need. And so we can think about looking at different water harvesting techniques in order to allow for adequate management of green infrastructure. And location of green infrastructure matters. Where we decide to implement green infrastructure can have a huge impact. We can get more bang for our buck by actually putting green infrastructure in areas of dense urban areas, of areas of high impervious surfaces. Research that we've conducted also showed that by targeting vulnerable populations in their communities, that we can actually save twice as many lives by actually targeting our interventions in areas for vulnerable populations. And then also when thinking about green infrastructure, it's important to think about size and the size of our infrastructure that we're putting in and the benefit from that. So these are some examples that also to show about that places like Paris are implementing. Paris is very susceptible to extreme heat. And so right now they are pushing through, putting green infrastructure throughout their city. And this is in front of all their big monuments in order to really start reducing their extreme heat. And they're also having watering and sprinkling systems in order to just bring water into the environment. It's the evaporation of water that actually does a lot of cooling for our near surface air temperatures. And so when we're thinking about extreme heat, it's important that we think about the vulnerable populations and to understand that heat hits us differently depending of our situation. And so we see that the very old or the very young are impacted more severely by extreme heat. And so cities are actually starting to develop vulnerability indices in order to identify areas of high vulnerability. And they're doing this by mapping vulnerable populations as well as mapping areas of high heat exposures. And so this isn't just a map showing Chicago's heat vulnerability index, but different things that they're mapping is they're really looking at what makes a vulnerable population with regard to looking at age, the very elderly, the very young, looking at income. Isolation actually makes someone very vulnerable, especially for the elderly. Access to air conditioning, but also pre-existing conditions such as diabetes, cardiovascular, respiratory diseases. These chronic conditions makes it so that our bodies are not able to respond appropriately to extreme heat and therefore not able to cool our bodies when we really need to. So these people also are more vulnerable to extreme heat and extreme heat mortality. And we think about Indiana and the number of people that are dealing with diabetes as a chronic condition, it really begins to make us think more about the vulnerability of our residents as a whole. And then also thinking about exposures. And so really this goes back into thinking about the urban heat island and understanding areas of high impervious surfaces like a green space, but also thinking about housing conditions, whether people are living in mobile homes or whether they have access to air conditioning, whether they have appropriate ventilation, also lack of transportation. All these things can really go to increase our exposures to extreme heat. And so I just want to wrap up the discussion by talking about how environmental sensing can start making our cities more prepared for extreme heat and make our cities smarter, or where we're seeing move in the smart cities movement. And so right now we're seeing that cities are putting sensors throughout their built environment, and there's lots of reasons to collect local environmental data. And there's a lot of reasons to do this for temperature data. As I mentioned earlier, we see that temperatures change dramatically within our built environment. So it's very hard to just depend on one meteorological station to really understand the heat exposures that everyone is being exposed to. And so temperature sensors throughout the urban environment can lead to better understanding of the heat exposures that our communities are being exposed to, people of vulnerable populations that are being exposed to, as well as planning for future development, to understand how our development is increasing these exposures as well over time. And so we see examples of these sensor networks. University of Minnesota had an extensive one with over 180 sensors looking at the change of temperature within their environment. Georgia Tech's Urban Climate Lab has one of the largest ones now that's still running with over 70 sensors that is throughout Georgia Tech's campus as well as throughout the city of Atlanta. And they're really using it to look how different development patterns are increasing temperatures in those local areas. And Chicago's Array of Things is probably one of the most famous and will be one of the largest with they are installing these modules, and the modules are collecting a lot of different environmental data, from air and weather data to sound and video data, in order to gather more information for cities to be more responsive and hopefully more transparent to people's environmental conditions and hopefully more resilient. And so that just kind of leads me to the work that I'm working on now here, is that I'm pushing on looking at environmental sensing as a way to really look at how temperatures are changing in the built environment by looking at both temperature and relative humidity, but also looking at soil moisture sensors as well in order to see how soil moistures are impacting our climate. But I'm also interested to looking at how our green infrastructure is performing in times of extreme heat, and what do we need in order to actually implement the correct types of green infrastructure in cities in order to cool our environment. Also, I'm interested in looking at, I'm in the process of looking at ambient, of wearable temperatures as well, and to see how we can collect heat exposure and heat stress for individuals in order to try to give them real-time alerts when they need it. Thank you very much, and thanks for having me today. And I just want to thank the National Science Foundations for sponsoring a lot of this research.
Thank you, Dana. That was really interesting, and I think you gave a very compelling and broad overview of the kinds of things the impacts that extreme heat will have that people may not think of, and also things that we can reasonably do. So I think it is now time for questions. Andrea, do you want to orchestrate that?
Sure. So to ask a question, you're welcome to unmute yourself, which you can do by hovering your mouse over the screen. And there's a microphone, which may currently have a red line through it, but if you click it, that red line will disappear and you'll be able to ask a question. If you're not comfortable with that, you're also welcome to type a question into the chat function, which again can also be accessed by hovering your mouse over the screen and clicking on chat.
And while people are thinking if they have questions, I wanted to mention the Dana showed the slide about the Chicago heat wave. There's an excellent book called Heat Wave that's all about that Chicago event by a man named Eric Kleinenberg. That just tells the story of what happened there and how it was that there could be two neighborhoods side by side, pretty similar in terms of poverty levels and demographics. And in one community, people really suffered, and in another community, they didn't so much, and there were fewer deaths. And what was it that made the difference? And the takeaway that I had from it was it's the community structure, and we're neighbors looking out for each other, or were people living in situations where they were alone and afraid to open the door when somebody knocked on it because of crime and that sort of thing. So really interesting, very interesting book. If you read it, I suggest you get the newest version, which has a new prologue updated and to reflect later climate information.
So we have one question that's come in, and I believe this one will be for Dana, but Melissa, you're welcome to comment on it too, and Kim or others, if you have comments, please speak up. They're wondering if you can speak a little bit more about specific policies that can be adopted within local governments to help address the different design issues that are leading to higher temperatures in communities.
Yes, so there's a lot of different things that communities can do. I mean, one aspect, we see that sprawling cities have higher urban heat islands effects than non-sprawling. So one idea is also to think about the overall containment of a city. But then it's also looking at how we can bring green infrastructure into environments. And so those are the two that really talked about with regard to albedo and green infrastructure. And so tree ordinances can go a long way with regard to protecting tree canopy, but also there's other types of zoning policies that cities are starting to use, such as green area ratio policies, which are making property owners have a certain ratio of green area, and it allows them to decide what's the best way they can do that. So if they want to put a green roof on or not have a driveway, or and so those are policies to look at the the different private ways. And so then also it's what types of, for other private investments, is thinking about how you can promote, like where you're promoting development, and then maybe promote more development, such as higher densities in areas or higher floor area ratio, especially if you have an area that is a well sought after area. Then you can allow for some higher density in those areas if they provide for more infrastructure that is going to cool that environment. And so with the green roofs or a higher green area ratio or larger tree preservation programs. So there's, and then in general conservation too. So I think there's a lot that we can do. And then even, I think it also depends on what types of strategies you want to bring in. So then there's a whole different policies that we can start thinking about with agriculture and urban agriculture, and how's our zoning policies promoting agriculture in our cities, or do they even deal with those with agriculture as a green infrastructure, strategy?
I think too, I mean, this is an area of great interest, because one of the ways you can be most impactful is to get good policies embedded into city ordinances and comprehensive plan guidelines, because then they just become what cities follow. There are a number of efforts to try to bring best practices together, and of course these cities are interested in knowing what other cities have done in that space, and maybe not being the first and most out there on any particular thing. Drake Muscle has a project going to pull a lot of information together. It's something that I'm interested in the Environmental Resilience Institute trying to package in an accessible way for Indiana communities. But Andrea, maybe we could, in the post-webinar message, we could send a link to the Drake website. And I don't know if they're doing best practices sort of chunk by chunk, different subject matter. So I don't know if they've hit this one yet. So then,
sure. Certainly.
Yeah. Matt Mosier asked a question that I think is really for Melissa. Is there any research to quantify amounts of ozone precursors by mid-century, or better yet, expected number of high ozone days by mid-century? Excellent question.
So I know those were part of the discussions when the team was working on their report. That specifically came up, and I'm guessing that since it was not in the report, it was not readily available, but that doesn't mean somebody is not working on it. I personally do not know that. I think Gabe Filippelli, the lead author, would probably be the best person to follow up with on that question, or if there's anybody else on the call who knows that.
Well, I know that a lot of urban heat is experienced in urban areas, but what about in more rural areas? And Dana, I think you mentioned that you have some research related to the role of agriculture in heat exposure. Could you talk a little bit about that? And then maybe if you have anything you want to add to that, that would be great, Melissa.
So, I mean, we see with any type of land cover change that you can see a change in local and regional temperatures. And so depending on that natural vegetation that was in place, and depending on the practice that what we're using that land for, you can see that rural temperatures can also increase in those general areas. And so whether it's going directly towards agriculture if it's irrigated, can show some positive impacts, but oftentimes you see fields that are just, are at certain times have a lot of crops, and at other times are just bare soil. And so you can see a lot of that fluctuation because of land use. So we can think about that as well with regard to the urban heat island, those same principles apply to rural areas, as how are we changing that land cover and how is that impacting temperatures. And then also when thinking about rural areas, we can think about vulnerability differently as well. And so if people have less access to cooling centers, or less access to public education or awareness, or less access for transportation to to get away from their home if they don't have air conditioning. So I think we also have different types of vulnerability due to communities in the rural environment as well. And so one thing to think about is like different types of homes, like mobile homes as well, can become very vulnerable areas and housing structures for communities. And so that's something that we definitely don't want to overlook because they're in the rural environment.
I'm sorry, go ahead.
I was going to say, just to add to that, this is Melissa, just to add to that, not only is the land use and land cover playing a role directly with temperatures, but also with the moisture levels and the evaporation, and that can certainly have a broader impact on the whole area, not just out in rural areas. So thinking about our summertime temperatures here in Indiana, they're not going up as much in that absolute high temperature of the day. And there's a big component of that due to the intense corn growth that we have and how those increased humidities tend to moderate that daytime temperature. But it also has an effect on moderating that nighttime temperature. And so we've been seeing a pretty strong increase in our overnight lows in the historical record, whereas we haven't been seeing that same strong increase in daytime high temperatures. Well, those both have very serious impacts on health. So you're sort of shifting the burden there of the type of health impact or the way that the health impact is happening, but you're still getting it, right? So you're still not going to be cooling off as much during those intense heat events, which means you're not recovering as much. And, you know, that surrounding land use is playing a role too with the moisture component. So it's not always just the color and the texture and all of that for daytime heating. There's a moisture component at play too.
So I, for one, was not familiar with the importance of nighttime temperatures in the public health impacts of increased heat. And maybe I just missed the boat somewhere. But if I'm a bellwether, then I think a lot of people don't understand that it's really important that we cool down at night as well too. Most people, I think, could sympathize with lying, sweating in your bed and kicking off the covers, even when you have the air conditioning going at night. We do have another question about the Hoosier Resilience Index and the November webinar. The question is, does the Do-It-Yourself Resilience Index apply to places outside Indiana? I'll respond briefly. It could is the answer. This tool is highly tailored to Indiana. We're using information and data from the Indiana Climate Change Impacts Assessment and other Indiana-specific databases that will provide a vulnerability profile that is specific in Indiana, and then the worksheets that each community gets will be related to the particular vulnerabilities that they have. So for example, if it's a river city and they're very subject to flooding, they will have questions that relate to that. And if they're not, they won't have to answer those questions because it's not relevant to them. That said, it's going to be as much as we can do to get this Indiana-focused tool out and into people's hands and using it in November. That said, the worksheets that we've developed are perfectly appropriate for anybody to use, and we're pretty excited about them because we think they highlight some of the key priority things that people should be thinking about in order to determine their resilience to heat and flooding and the things that all come from that. So if you're interested in it, please sign up for the webinar and learn about it, and we'd be happy to follow up with you individually if you think it's useful. So I think we're done right on time. I want to thank our speakers again, Melissa Widhalm, Dana Habib, and our speaker and welcomer and new sponsor for these health-related ones, Kim Irwin, very much. Thank you all for joining. We're going to do more of this next month on different aspects of health impacts and climate change. For those of you that are on the line who work in the public health area, might be from a local health department or some kind of organization, I know Andrea would too, greatly appreciate your feedback on the kinds of issues that you would find helpful to learn more about, because one of the great things about being located at a huge university is that we have access to a lot of experts on a lot of different topics. And we want to provide information that is of most interest and most use to you. So with that, I will say thank you one more time. Andrea, any last words?
None from me. Thanks to all of you for joining us.
All right, have a good day, everybody. Stay cool.
Take care. Bye.
Goodbye.